In the United States alone, it is estimated that the treatment of decubitus ulcers, more commonly known as pressure sores, costs in excess of $1 billion every year. And in the UK, 4% of the NHS's budget is spent on this. Once formed, pressure sores can take months to heal. They can be quite painful, and they can become complicated, adding to existing health problems. And all of this can prolong the costly stay of a patient in hospital. Studies have also suggested that any patient undergoing surgery for more than 20 minutes faces a risk of pressure injuries caused by immobility during the operation and the use of anaesthesia. This is because healthy tissue viability depends on a continuous supply of oxygenated blood to perfuse it via the arteries and arterioles. When pressure is applied to the body surface, blood flow is reduced. This is more pronounced when there is an underlying pressure point, such as the occiput in the skull, ischial tuberosity in the pelvis, or the calcaneus in the foot. Blood flow is rapidly compromised if pressure is sustained to these areas. The compromised blood flow leads to lack of oxygen and nutrition to the surrounding tissue, resulting in tissue damage and eventual death of this tissue. This dead tissue may break down, resulting in a decubitus ulcer of the heel or pelvis. In the case of the scalp, alopecia may occur in the milder cases, and this is a common occurrence. However, gangrene and ulceration may occur if anoxia is prolonged. VascoCare Medical has developed a line of evolutionary patient positioning and patient stabilisation devices that protect against acquired pressure injuries. VascoCare is the only company in the market to do clinical testing that includes full perfusion imager analysis, which are used to substantiate the validity of pressure mapping. The Evolution Supine Head Positioner uses this new patented technology. It is the next important scientific breakthrough in the prevention of pressure injuries to the occipital region, and it represents an important transition in safer patient positioning. Clinical pressure mapping tests carried out in the supine head positioners in comparison to contoured head pads, gel head rings, and a standard pillow show that no interface pressure was detected to the occipital area when using the supine head positioner on patients with prominent occipital bones, whereas most values detected on the market equivalents were above 100 mm of mercury, and in some cases over 200 mm of mercury at the occipital area. The supine head positioner has an occipital opening that ensures no pressure is placed on the occipital bone, and this helps to prevent the formation of decubitus ulcers and pressure alopecia. It also provides better neck support. Tissue viability tests have also been carried out on the supine head positioner by a group of expert researchers in the field of biophotonics and imaging at the University of Limerick in Ireland. Again, for comparison, contoured head pads, gel head rings, and a standard pillow were used. As illustrated, the Evolution Supine Head Positioner caused a minimal reduction in perfusion to the occipital area, whereas the market equivalents had a post-perfusion unit of between 600 and 1200 pu, only decreasing to normal baseline levels after 10 to 20 minutes. Another important feature in safer patient positioning is maintaining normothermia. The supine head positioner has air channels incorporated in each side of the product, and this promotes air circulation and helps to create a thermal neutral effect at the occipital area. Temperature sensor tests were performed on the skin at the occipital area when using the Evolution Supine Head Positioner, and again comparisons were made against contoured head pads, gel head rings, and a standard pillow. As illustrated, the skin temperature did not rise above 0.8 degrees centigrade with the Evolution Supine Head Positioner during the duration of the trial. However, the market equivalents are considerably slower to warm. Taking heat from the patient and the pillow actually acts as an insulator, warming up the occipital region by 2 degrees centigrade. There are two styles of Evolution Supine Head Positioners. Style 1, with 3-fingered lateral supports to provide excellent pressure redistribution and stable head support, and Style 2, with 2-fingered lateral supports to achieve ease of endotracheal intubation. Each style of the positioner is available in 3 sizes: small, medium and large, to ensure they closely match the patient's profile. The head positioner also sticks to the theatre table. Disposable covers in matching styles and sizes are available for the positioners, and they provide a soft, comfortable support for the patient. Each cover is made from a breathable, non-woven fabric that absorbs excess moisture from the patient's skin. Like the positioners, the disposable covers have a hole in the occipital region to promote normothermia. The positioners can be used with or without these disposable covers. Because it has a duromorphic coating, that is resistant to disinfectants, impervious to moisture, and very easy to clean. The Evolution Supine Head Positioners are ergonomically designed to comfortably fit the patient, and when their weight is applied to the devices, it creates a cupping motion that reduces side-to-side movement, and this eliminates the risk of shear motion on the bony prominences and other body parts. The inside of the positioner is manufactured using viscoelastic foam, and this has pressure-relieving properties forming a natural contour to the patient's profile. The inner materials are also specifically designed to have a slow memory, hence offering less resistance to the weight of the patient. The material will quickly return to a normalised state after use. The Evolution Supine Head Positioners are extremely durable, and even though the positioners are lightweight, they are tear resistant and they can withstand accidental drops and falls. Unlike comparable devices, the Evolution Supine Head Positioner requires no prior heating before use. It is also fast and easy to determine the correct size of positioner for each patient with the use of a specifically designed measuring tape available in both disposable and reusable format. The Evolution Supine Head Positioner surpasses all of the requirements for a specific positioning device in key procedures. It is lightweight, durable, versatile, and scientifically proven to improve protection against pressure injuries. Trials have shown that the Evolution Supine Head Positioners are dramatically better than comparable positioning systems. The Evolution Supine Head Positioner is one of the patient positioning devices from VascoCare Medical. The full range of supine Evolution patient positioners will be available during the course of the year. To learn more about the VascoCare Evolutionary Patient Positioning Device and the Evolution Supine Head Positioner, please visit the VascoCare website to locate your nearest authorised distributor.